Welcome to a University of Maryland, Baltimore Virtual Research Advisory Task Force Town Hall. I'm Alex Lakowski, Executive Director of Media Relations. Education has always gone hand in hand with research at the University of Maryland. Among what it called the many benefits the General Assembly was hoping to promulgate when it established the College of Medicine of Maryland, even if it didn't use these words, were improvements to the lives of Marylanders, improvements to the human condition. 2 centuries later, the College of Medicine of Maryland has grown into an entire university system of Maryland with 12 institutions across the state. Here in Baltimore, UMB's 7 schools comprise a thriving hub of biomedical, legal, and social science research with extramural funding totaling $667 million in FY 2018. That same year, our sister institution, the University of Maryland College Park, garnered $545 million in research grants. That's more than $1.2 billion for the combined research enterprise. In Baltimore alone, more than 40 research centers and institutes focus on a dizzying array of topics: chronic pain, regulatory science, health outcomes, health and homeland security, human virology, genomic sciences, and the list goes on. And in recent years, we've seen the growth of many new avenues of research collaboration between Baltimore and College Park under the University of Maryland Strategic Partnership, also known as Empowering the State. But the greatest part of all that work came to a halt March 23rd when the threat of COVID-19 forced the curtailment of all activities not critical to maintaining animals, unique reagents and cell lines, and essential equipment. Left standing, of course, has been research related to COVID-19, and there's been quite a bit of that, including trials of 4 variants of Pfizer's mRNA vaccine candidate and studies with hydroxychloroquine and remdesivir. Now, 2 months later, Dr. Gerald has announced that the university's COVID-19 Research Advisory Task Force has developed a phased plan for non-clinical laboratory-based research at UMB. Phase 0, now in effect, involves planning and preparation for the gradual and deliberate reopening of on-campus research activities with a proposed start date sometime in June. That next phase, phase 1, envisions research restarting at approximately 25% capacity with some restrictions. Joining Dr. Gerald today to talk about the plan to reopen research here and in College Park are Daryl Pines, the Glenn L. Martin Professor of Aerospace Engineering, Dean Emeritus of the A. James Clark School of Engineering, and President Designate of the University of Maryland College Park, and the leaders of the UMB Recovery Task Force's Research Advisory Task Force, Laurie Locascio, Vice President of Research for both universities, and Peg McCarthy, the James and Carolyn Frankel Endowed Dean's Professor, Professor and Chair of the Department of Pharmacology at the University of Maryland School of Medicine. Welcome to you all. Before we begin, let me say that this program is being recorded and will be posted on our COVID-19 website, umaryland.edu/coronavirus. And a little later in the program, you, the audience, will have a chance to ask your questions or make comments. Look for the tools at the bottom of your screen and click on the button with the speech bubble. That will open the chat function. If you're using a cell phone, you'll see that button in the upper right-hand area of your screen. Type your question there, and when the time comes, we may call on you. So please listen for your name and be ready to speak up. Now, with all that out of the way, here's our host, UMB Interim President, Dr. Bruce Gerald.
Thank you, Alex, and I'd like to welcome our 3 panelists here. It's a pleasure to be on the town hall with you. Our plan for today is to spend the first 3/4 of an hour approximately on the University of Maryland Baltimore plan, and then switch over to President Pines, almost, nearly President Pines, okay, who will discuss the overall system approach to research and its recovery. Sort of as a background, UMB has been following closely the governor's restrictions on these many activities since March. I looked it up just now, and there have been over 7,000 articles published on this topics 3 months later. So it's been a flurry of activity. And so I'd like to give a caveat for this discussion, and that is, as the world changes, and it will daily, we will make sure that our plans continue to be updated daily. The other thing I would comment is since that time, UMB has signed over $13 million worth of COVID-19 related research with companies and the clinical trials that Alex just finished mentioning. And one of our companies was recently acquired by a larger company in its relationship to COVID-19 treatment. So let me begin by saying this task force or the recovery for research presentation you're going to hear today is part of a general approach at the UMB level to make sure that we're organized in how we respond to COVID, both scaling down and now scaling back up activities. Dr. McCarthy and Dr. Locascio chaired an overall committee that looked at both basic and then a subset of clinical research. Today, we will only be addressing the recovery of the basic research plans that we are ready to place already into action. The governor has relaxed his position on activities, and we will slowly react and relax in response to that. So with that, what I would like to do is ask Dr. McCarthy and Dr. Locascio if they would present for the first 10 or 15 minutes what your task force is recommending, and then we'll open it up for questions of the audience. So Peg and Laurie, the show is yours.
Okay, thank you. Would you like me to share slides?
Yes, go ahead.
Okay. All right, well, thank you so much for attending this presentation today. We are going to be talking about the University of Maryland, Baltimore COVID-19 Research Advisory Task Force and the work that they concluded very recently and the report that was generated out of that. And first of all, of course, I'd like to acknowledge the Deputy Chair, Peg McCarthy, Dr. Peg McCarthy, who worked alongside me and the rest of the team in this work. And so I'd also like to thank the entire task force for producing this report. And as Dr. Gerald said, this report came out of the subcommittee on basic laboratory-based research. And there is guidance coming from the clinical research side that will be forthcoming very soon. And I'd also like to acknowledge the chairs of the subcommittees, Dr. Asaf Keller on the laboratory-based research and Dr. Steve Davis, who has chaired the subcommittee on clinical research. So this is going to be a very short, quick presentation. We realize there will be a lot of questions, but we want to walk you through the basic results of the report that was just produced. So as Dr. Gerald mentioned, of course, the governor has presented the roadmap for recovery for the state of Maryland. And in it, he outlined a phased approach for ramping up activities across the state of Maryland. And the report that we produced also followed a similar pathway, a roadmap for recovery, essentially, for research across the University of Maryland, Baltimore. And this, as the state of Maryland guidance produced, also suggests ramping up in 3 phases, phases 1, 2, and 3. Phase 1 is limited presence, phase 2 is ramping up, and phase 3 is full resumption of activities. But this is all preceded by a phase 0, and the phase 0 is very important. Phase 0 dictates how we want to come back onto campus in phase 1. And it really is a time of a very important preparation to prepare our labs and facilities for reopening and re-entry onto campus. And so at any stage, I think it's really important to note that at any stage along the way, public health conditions can change. Of course, we all know that this is a very fluid situation, and a lot of decisions have been changing and had to be made again as a result of this fluid situation. And so at very short notice, the University of Maryland, Baltimore President, Dr. Gerald, may revert the campus to a previous phase or completely close research activities. And we think that's a very important caveat for you to all be aware of because of the situation that we're undergoing in this pandemic. So phase 0 is the preparation phase, as I mentioned. And during phase 0, we will be providing a short form that needs to be completed by the PI and approved by the chair, the center director, or the designee. And guidelines will be provided by EHS, and that will include directions for implementing spacing and directional flow through your laboratories, et cetera. The most important thing that you need to think about during this preparation phase in a laboratory setting is how you are going to manage the social distancing aspects of of phase one. And so when I get to the next slide, I'll show you exactly what we are talking about in phase one. We will also be providing to you a detailed checklist for reopening. So those are the 3 things that you can expect from us. And as Dr. Jarrell mentioned, we are in phase 0 now. So this is the preparation and planning phase. The PIs will be developing plans for reopening labs. It will be consistent with the guidelines, and then you'll submit that to the department for approval. And it's very important to note that we are allowing 1 researcher per laboratory designated by the PI to be on site to prepare for reopening, to really look at your laboratories, think about the flow of personnel through your laboratories and how you're going to manage that social distancing aspect, which is really critical moving forward. It's also important to note that no research activities will be allowed during this phase, except for the work that is granted a research exception by President Jarrell. So phase 1 is limited presence. And in this phase, we're requiring all employees to take the COVID-19 safety training. And during phase 1, limited presence, and we'll talk about that again in a minute, we are requiring a low density of workers, 1 person per 200 square feet max. And we estimate that should be approximately 25% capacity, but no more than 25% capacity. We are requiring the use of masks, cloth or other masks that are available, but they must be used at all times in the common spaces. We are limiting the hours from 7 a.m. to 7 p.m. And we recommend that you do work in shifts to get as many people as you need to be in the labs as you can during this time. But remember, it's important again to limit the amount of people at any one time, and that's why we recommend working in shifts. We want you to think about the fact that we would like you to work at home whenever possible. Again, the point is to reduce the possibility of running into other people and to minimize the chances of having difficulty with that social distancing guidance. We want as few people on campus as possible during phase 1, which we deliberately call limited presence. And then finally, we'll have a web-based symptom tracking tool, REDCap, and Dr. McCarthy is going to talk about that in a minute. It's currently being implemented in the hospital, and it's being modified for use as a screening tool, and so she's going to be discussing more about that. I'm not going to be talking about phase 2 and 3 in this particular presentation because we're really focusing on phase 0 to phase 1, getting people back onto campus in a limited amount. And so now I'll turn it over to Dr. McCarthy.
Okay, thanks very much, Dr. Locascio, and thank you, President Jarrell, for allowing us to present this today. We had a subcommittee of the larger research committee that spent a great deal of time discussing the various merits of testing versus screening. And in response to the recommendations of a variety of different experts, many of them on campus and infectious disease experts, we came to the consensus that the best approach was to implement a vigorous screening procedure. And we were really fortunate to have Dr. Marion Cloran, who is an MD, but in occupational medicine, and she has been central to the modification of the REDCap app, which was developed by Vanderbilt, and as you can see, is now used quite widely for different kinds of tracking people. I don't think it was not developed as part of COVID, but it's turning out to be a very useful tool. It's a web-based application, so it will be accessible from any device, your phone, your iPad, your laptop, your desktop computer. And it is, as Dr. Locascio said, currently being used for screening at Baltimore Hospital. So that's our downtown and midtown hospitals. And what it does is provides you daily screenings and notifications to your supervisors about the results of your screenings. And Dr. Cloran is beta testing right now the modification of the app for laboratory researchers, and she anticipates it being ready by the end of the week. And then ultimately, they hope to have this accessible for all employees on campus because of its ease of use. The first question it's going to ask, not shown here, is going to be, are you going to go into the laboratory today? If your answer is no, boom, that's the end of that. And it will send a notification to your supervisor whom you have identified that no, John Smith is not going into the laboratory today. If you say, yes, I'm going into the laboratory today, we'll ask you, what is your body temperature? You are responsible for measuring your own body temperature if you have a thermometer to do so. If you do not have access to such a thing, you'll be asked, do you feel like you have a fever, etc. We recognize that not everybody has access to a thermometer right now. Next slide. You'll also be asked a series of questions about basically, how do you feel? Do you have chills, a cough? Are you having any trouble breathing? Do you have a sore throat? Do you have a decreased sense of taste or smell, which are turning out to be two very accurate harbingers of COVID-19 infection? Are you nauseous? Do you feel, have you been vomiting? Do you have diarrhea? Or other would be things like, I have a runny nose, I've developed a new rash, any kind of health symptom at all that you don't know what the origin of it is. If you answer yes to any of these questions, or you register a temperature of 100 degrees or greater, this will trigger a series of events, first being an email to your supervisor and perhaps the chair or director of your department, and more importantly, to employee health. You will then be sent instructions to immediately contact the COVID hotline, where you will speak in person with a nurse practitioner who will ask you further, more detailed questions. That nurse will then decide whether or not you are to be recommended for testing. If the answer is yes, you should be tested, you will go to the employee testing site on campus, although at this time, since more and more testing sites are becoming available, perhaps you can go to a different site. But if you go to the employee testing site, your test will be expedited, as will your results. And then subsequent events will depend on if you have a positive test. The EHS will be looking into things like when were you last in the laboratory, who were you in contact, et cetera, and various innovations that we have going on around contact tracing, much of which is still in the works. The test is negative, well, that's good news. So then when you feel better again, you'll be ready to go back to work. Next slide. So these are your takeaway messages from our brief presentation, and this is the status of the sort of action items. First is that there is a reopening safety plan form, which Dr. Locascio referred to. This is in its final stages. We're just tweaking it. It should be sent to the PIs soon. It will be a database to track the number of people in your laboratory, discuss how you're going to manage the spacing, distancing, et cetera, and basically to help you formulate your plan. And then it needs to be approved by your departmental chair. You will also be required to take an online COVID-19 safety training. This is, as I mentioned, in beta testing, and it should be available by the end of the week. Everybody who comes on campus is required to take this. This is very similar to the test that you take for using animals or working with hazardous materials. It'll be on the same website that you're used to on the university website. There's an online safety guidance and lab opening checklist to assist you. This will be a very useful guide in formulating your safety plan as well, but also all sorts of news you can use, kinds of information about keeping your personnel safe and fostering you a healthy laboratory environment. Also available later this week. The red cap screening tool, as I mentioned, is also in beta testing. This slide was made before we got the news that we think that that's going to be ready by the end of the week. We're very excited about this. This is a really novel tool that we're using here. From all of the other universities we've been talking to, we haven't seen this kind of tool being used for the research environment. And then lastly, EHS will be doing a lot of work on signage. They're going to close some entrances to the building. They might have, your building, if it has multiple entrances, might have one door you go in and another you go out. Limited numbers of people on elevators, and et cetera. The kind of common sense practices, but these will be very carefully spelled out by environmental health and safety under the supervision of Steve Deck, who has been really instrumental in keeping us safe. And that's all we have. I think we're ready to take questions.
Thank you, Peg. For those of you who have questions, it might be good for you to write them in where Alex told you to write them in, where the bubble is. The one other thing that I would add is, remember, when you walk into your lab, other things have to be ready as well as your lab and lab personnel. So the lab has to be properly cleaned, and there will be the facilities management will be very involved to make sure that your lab has been cleaned properly. EHS will be very involved in terms of making sure that things are ready to go. So there's a number of coordinated events that need to take place over the next couple of weeks to make it safe. Our intention is to make it safe. and we'll go back to the labs as soon as we're satisfied that all those things are in place, which I would hope would be sooner rather than later. So, Alex, do we have any questions?
We do. We have a number of questions. They're starting to come in. First, here is Rao Gulapalli. Rao, are you there?
Yes, I am. Hi, thank you very much. I think I understand the probing the PIs with respect to their needs and social distancing and keeping a safe environment. Would the guidance be similar to managing cores, for example, because where the traffic might be slightly higher, and would it follow a similar pattern?
Peg, I think you had some opinions on that.
Sure. Hi, Rao. How are you? Of course, we want all of the cores to open as soon as possible because they're so integral to the research. Most of the cores already have swipe card access, and so that will be a nice way to both monitor who's going in and out, as well as sort of limit. You can maybe set a limit of the number of people that can go in. They also, many of them that allow users to use equipment have strict scheduling requirements, and then there'll need to be guidelines posted about cleaning common equipment after it's used and how that's to be done and the like. So I think in general, the same spacing is required for everything else. But one thing is we recognize that sometimes people can't keep 6 feet apart. Sometimes you need to actually work side by side. And in those instances, it will be absolutely imperative that you wear a mask and that all services are cleaned after you, depart from them, et cetera. So, and to limit the amount of time that you're in close proximity to another person to the shortest possible time that you can.
Alex, next question.
Yes, Emily Smith has a question about access. Emily, are you there?
Yes, hi. I was just curious if I saw that the scheduling was from 7 a.m. to 7 p.m. and I was curious if that also included weekends.
Yeah, that scheduling actually, it's not, your work is not actually limited to 7 a.m. to 7 p.m. What is happening is, as part of an energy reduction strategy for financial savings, we are doing a 30% setback outside of those hours in terms of air turnover and also in terms of chemical fume hood venting. So that the air changes, which are normally about 8 times an hour, will reduce to only 4 times an hour. So you might experience rather extreme, well, not too extreme, but more wider temperature swings than you will from 7 to 7. So they estimate the temperature swings should be from about 68 degrees to 76 degrees. But on a really hot summer day at 8 o'clock at night, it could be a lot warmer than it normally would be. You're not restricted from working outside those hours. We just recommend that's something for you to keep in mind as a framework.
And I think it's important that's going to be in the guidelines that we're going to be sending out as well, because there is an important safety issue there if without the fume hoods operating maximum efficiency, and also you need to be aware of any possibility that temperature fluctuations can impact the research that you're doing as well.
And if you have a circumstance where you absolutely cannot tolerate that kind of temperature swing, you should have been sent a questionnaire already asking you about that, but it's not too late for you to say, I need this room in this building to not ever be having a 30% setback. And the buildings people are happy to accommodate those requests.
Alex?
Yes, Denise Orwig has a question about research with human subjects. There's something a little different twist. Denise, are you with us? I'll try to unmute her again. Denise, you are there to ask your question.
Hello, I'm sorry, I'm not sure if my microphone is going to work that well.
It's working. Go ahead.
Yeah, so this language obviously is very focused on laboratories, but majority of our research is done with human subjects. And so it's kind of getting frustrating because we have 2 large ongoing NIA-funded studies where we recruit older adults. A lot of our screening and recruitment activities can be done in the home, but then we need to bring them in for clinical or assessments, either to the GCRC or other locations on campus. And so can you address when these types of research activities will be identified or acknowledged, and when we can potentially start these back up again?
Yeah, hi, Denise. The clinical research group has been very active. I met with them again last week. We expect to have some recommendations in the next week or so. I'm acutely aware of your concerns, but again, we're trying to do this in an orderly fashion. So I think my answer is going to be more to follow shortly. Alex?
Yes, sir. Well, Ashley Mitchell is a student, has a question about students needing to complete their research. Ashley, are you there? Well, she's asked, I think I pretty much given you the question. She wants to know, what about students who need to complete research
Sure.
for their dissertation? Oh, Ashley, go ahead. Ask your own question. Oh, I thought we had her. But what about
We can
students?
speak to that. Yeah, we can speak to that because that was considered very carefully within the groups, within the task force. We looked at graduate students and people who are doing research and who are, I think, in a particularly vulnerable situation where they're at a very important part of their career. So therefore, being out of the laboratory has been particularly detrimental for their future and for their career. And so graduate students were one of the subset of students that we looked at, other students doing research in the laboratory who at this particular point of time, it is the most detrimental of their career, as well as young investigators and young researchers, young PIs who are on a tenure clock. We considered all of those as well as postdocs and recommended that is given really important consideration as we consider who should be moving back into the laboratory in the limited presence in phase 1. Now that said, it doesn't mean only the graduate students come back, of course, and it doesn't mean only the young PIs come back, of course, but it does mean that we should take careful look at those people who are really suffering as a result of the fact that they have been out of the laboratory for this amount of time in a very critical point in their career. And I don't know if you want to mention anything else about that, Peg.
Yeah, I think that the short answer is yes, students, you're welcome to come back into the lab under very, careful circumstances of being extremely cautious and aware of your own safety and the safety of others. And one thing that you want to do when you come back, and I will tell you, I've been admonishing my own lab about this, is plan your first experiments to be very short and very quickly executable. So in case, heaven forbid, we have to go to a very quick stoppage again, that you haven't planned, you haven't started to invest in a 6-month-long experiment. So try to do everything you can to do something that you can achieve on the short term to start off here.
And there was also a discussion about the fact that we should be prioritizing those who are advanced in their research, so maybe 3rd and 4th years, as opposed to people who are just beginning their research, especially during phase 1.
Thank you. Alex?
We have a number of questions about PPE, especially purchasing PPE right now. Here's Gloria Reeves. Gloria, you want to ask your question?
Yes, thank you very much. So my question is if there'll be a central process for both procuring and funding PPE in any way. So we're concerned about being able to access vendors who have adequate supply, but also funding not just for PPE needed by researchers, but eventually to be needed by human participants in studies, including things like folks who are going to be going in an MRI scanner and need a specific type of mask, or folks who are going to have a procedure done as part of a study visit. So can you please comment on PPE, please?
Yeah, maybe I should address that one without being able to give you a complete answer. Even as recent as this morning, we discussed it in our work group about better access to masks to start off with, but looking at other PPE kinds of things. We would very much like to coordinate that at a campus level. But I think in these days, if you have a really good connection, one, you might want to exercise it, or two, you might want to call one of us in central administration and say, I have this opportunity. Could you either help me out or advise me? We've used this to great impact at the University of Maryland Medical System, where many of you, I might add, I include you, provided resources to the medical system, and they now have a very effective program at finding these things. Now, they're not the source of all of them, because they have a high burn rate on these pieces of equipment. But there's a lot of energy going on at the campus level to try to identify these. There is also energy going on at the University System of Maryland level to again see if there aren't large state contracts that we could get and use our purchasing power to make these things available. So I don't have a specific answer for you now, but again, this simply underscores the fact that in order to come back to anything, whether it's clinical research, basic research, or anything, these logistical things need to be put in place in order to safely begin, in this case, research. So I think we will have more guidance for you on that shortly. Peg or Laurie, anything to add on that?
I would just say that, yeah, people are acutely aware of the need for PPE, and Carol McKissick in Bioresco has been aggressive about putting out some bulk orders to get in onto the wait list, as has Steve Deck at EHS. And so they're making some bulk orders so that every lab isn't left on its own to order what it needs. I know, Gloria, you're talking about something that is more intensive if you're talking about things like imaging and stuff like that. But they've gone across the board in terms of the variety of types of PPE, including gowns, aprons, face masks, etc., as well as the standard gloves and masks that a lot of laboratories will need.
All right, Alex, another one?
Yes, Karen Underwood is next. Karen, are you there? All right, well, Karen asks, will there be a risk assessment for service engineers? We've also had a similar question about elevators and hallways. How are they going to be cleaned? There are a lot of concerns about the environment being prepared for people.
So again, I don't know that we have specific answers to give for you now. Remember, we have been working under an essential employees only set of rules right now. So in order to ramp up research, for example, we have to get these people back in, get them up to speed, get them trained to do things properly. And originally, you may recall, we said people would get 2 weeks notice before they would be asked to return to campus. So that's taking place, but we've got to get them up to speed and running. So EHS is acutely aware of this, paying close attention to it. There will be further guidance on exactly how we will roll this out so that you're aware of what the rules and guidelines are and what's being done in your lab. Peg or Laurie, anything to add on that?
I don't have anything else to add.
Yeah, I just say that I think when you see the guidelines from EHS, which will be available within the next few days, you'll feel a lot better about safety.
Alex? You're muted, Alex.
I muted myself. How about that? We have Kamal Modgil. Kamal, are you there?
I know that some of this information would be coming soon, but in phase 0, can a lab member who was previously not declared essential enter the lab now in phase 0? That's one question.
Yes, that's a really important part of phase 0 is for one person per laboratory to come onto campus when necessary to prepare the lab for reopening. So that's a really important difference between what we were doing previously and what we're doing now. Now, that doesn't mean that that person is coming onto campus to do research. It's really important to differentiate those two things. It means that you're coming on campus to look at the lab and prepare it for reopening. But yes, in phase 0.
Alex?
Okay, Chris Holt is a graduate research assistant. Chris, are you there for your question? All right, well, he's asking, when will first-year GRAs be allowed to come back? Everyone's anxious to come back.
Well, as a first year, I assume he means starting to do laboratory rotations, I would assume.
I think so, yes.
Yeah, and I would say that partly that needs to be done in guidance with GPILs, assuming he's a graduate student in GPILs, perhaps he's a graduate student in the School of Pharmacy or medical technology. So that's going to have to be done very carefully in coordination with them. I would have to say I don't think those are going to be the first top priority, as Dr. Lacasio was saying. It's people whose research is already engaged. I would be looking more towards the beginning of phase 2 to begin laboratory rotations. But I thank Chris for the question, because that is something we should address explicitly. And we will engage the graduate program leaders in a discussion on that and see if there's creative ways we can find to get those rotations going again without putting very junior students at risk.
Alex?
All right, let's try Michael Richmond. Michael, are you there? Michael has a question about animal research in phase 1. Will there be animal research allowed in phase 1?
Absolutely. Order your animals now or start breeding them if you need them.
Okay. Alex?
Okay, I'm gonna read a question here. A lot of people are asking, I think you mentioned this, what the timeline is for phase 1. Like when do you suppose we'll get to phase 1, and what should they be doing now in advance of phase 1?
You'll get 10 different answers for this and I'm afraid at this point. We've chosen, for the sake of discussion, to use the expression sometime in June. I'd like to see it sometime by the middle of June. But again, there's a lot of pieces that have to be in place, so we're a little uncomfortable making a final date until we get a few more ducks in a row here. So I'm going to take the position of somewhere in the middle of June is when we're likely to start up phase 1. Now, having said that, all 4 of us on this panel want it started just as soon as it's safe and possible to do so.
Okay, Ruth Cosentino has a question. It's a little more sort of speaks to what sort of criteria should be applied to know that you're ready to return. Ruth, are you there? I must be getting to people fast, or they're a little shy today. But she says, in her case, her basal body temperature is 97.6. A temperature of 100 degrees is very high for her. How would that reflect whether she's available to report to work? I mean, would she have a fever under your guidelines? In other words, what should people, everyone's a little different. Or should they follow the rules very specifically, or should they be talking with somebody about what conditions are like for them?
Yeah, I would say that's where the first step is a call to the hotline, where you will speak with a nurse who is very knowledgeable about what the symptoms look like for COVID-19. And that nurse will ask you a lot of detailed questions, which would include things such as, you could explain to them that what your normal basal body temperature is. And you might say, and I, feel nothing, they'll make a knowledgeable decision on whether or not you should be referred to testing. Testing is not automatic if you answer yes to any of the symptoms.
Alex?
We have TB. That's all I know is TB, who is a core director and has a question. TB, are you there?
Yeah, sure. I run the confocal core, and I'm wondering if there are going to be forms and plan approval procedures that will be required for the cores, like there are for individual labs, so that we can get approval to know that we're okay to reopen for non-essential research.
Yeah, I don't know if you could hear all that, but
I could hear it. Hi, Tom.
Okay, go ahead.
Hi, Tom. You sounded terrible. Talk about a frog in your throat. That was
technology.
You had a giant toad in your throat. At this point, we just recommended that all cores open, but we haven't given we haven't made any specific forms for cores because every core is unique. And as you know, your core is unlike any other. It might be a good idea, though, for you to think about autonomously to set some guidelines that you're comfortable with. To make sure that you keep your staff safe and that the equipment, what is the rules for cleaning the keyboards in between, or the dials on the microscopes, and etc. I will admit that that's the kind of deep in the weeds details that our committee didn't get to, beyond the idea that we know the cores are essential and they need to open.
But also to think about, flow of people in and around and through those types of facilities is really critical, because the building managers will be thinking about flow of people through the buildings, but you really need to think about flow of people through your cores, through your facilities, through your laboratories.
One
There may
question,
be-
Tom, sorry, would be is whether or not you could look into the possibility if it's feasible to disperse some of your microscopes into other locations so that you have more access, because I know right now they're quite concentrated within your core, and there might be empty, lab space that if it's not damaging to the equipment or violating warranties or anything, that if you could do that and then would increase usage by increasing access.
The one thing I would underscore here, and I hope it's coming across, is that we have a lot of confidence that the principal investigators and the people in the lab are going to act in the best interest of all of those in the lab, as well as the university. So as you've just heard, there's some discretion in how you manage your lab. We're obviously looking for a safe environment, but you're all responsible individuals, and so we're taking the position, therefore, that you'll be responsible on this. It's a privilege to be opening up our research labs, and at the same time, it's a big responsibility to each of us to make sure it's done in a safe manner. Why don't we do one more question, Alex, and then I'd like to introduce Dr. Pines for the next section here.
You just saved me a message I was typing you to that effect. We have Brian Mather here, who has a lab, I think, with an open format. Brian, are you there?
Yes, I guess my question was beginning to be answered, and I'm sort of interested in what the granularity of the approach of EHS will be. Peg, you mentioned that they're going to be informing us what doors we can exit and enter, but what about the specific labs? Are they going to work with the labs to determine entry and exit points in optimal traffic flow to limit interaction?
Yeah, I think that the answer is yes, but I also think it's perfectly appropriate to be proactive in a large lab that includes 3 PIs, such as your own, and actually there's 4 PIs on the floor, to start thinking now about, we know the traffic patterns better than EHS does, right? Which door do you want to be the go in door? Which door do you want to be the go out door? And making sure that people don't put their hands on the doors. Just we can make our own signage too that says, use your shoulder, not your hand when opening the door and things of that sort. So I don't think it's going to be coming in directed. And I think EHS welcomes your participation in the process as long as you're following the guidelines that they provide. They don't want to have to be the safety police. They want to work in partnership with us to make sure we make it as effective as possible.
Yeah, and they might not also know, for instance, how many people are going to be on that microscope that's next to the other microscope, right, as people are working through the lab. So I think that you, like Dr. McCarthy said, your space. So think about that, and you can make good decisions based on that, given the guidance that's going to come out.
Okay. First of all, I thank you all for your questions. What I'd like to do now is to move on for Dr. Pines. Daryl, you have some slides, don't you? So by background, not only did UMB engage in a very significant effort, which you have seen here, we also engaged with a group of individuals, including Dr. Pines, to be able to make recommendations to the other system universities about a broad range of things. Including restart of research activities, but not limited to that. So we've looked at how we might make recommendations for undergraduates to return to the campus in the fall, and a number of other activities. But this particular discussion will be limited to restarting research activities. And again, this is focused on basic research activities, not human clinical research. So if you go to the next slide, please. In this testing group, some of the people here you will recognize. There's a number of people from UMB, from College Park. There are several from UMBC, and then several from the University System of Maryland, Ellen Herbst and Joe Bachman, whom many of you know. Could you go to the next slide, please, Alex? And what we wanted to do was to give advice to our colleagues at the other universities in terms of starting research in a phased approach. And as I said, primarily benchtop. We also looked at technology that could be brought to bear in monitoring the campus community during this gradual reopening. And so I think most of you can understand that it's not only important for us to know what kinds of practices we're doing, but also if those practices are somehow failing. In other words, instead of COVID being under control at our university, it is escalating, and we don't want that to happen. So as there are hot spots or as there are issues that come up, we want to be able to recognize them and take a proper actions. So what Dr. Pines is going to do is discuss with you a more skeletal outline of what we're going to be thinking about for research startup as a general response. It differs a little bit from what Peg and Laurie have shown you. This is a little earlier in its phasing, and so both of these plans will evolve, but this one perhaps will too. But he's also the former Dean of Engineering and has a lot of expertise in technology that might be brought to bear for monitoring us in a variety of ways. So I'll turn this over to Dr. Pines to talk about the programs that he's been studying. Darrell?
Thank you, President Jarrell. I also want to mention that President Jarrell is chairing the USM testing group, which is what these recommendations are coming from, or where they're coming from. And this is, as he has mentioned, an incredible, diverse group of talented individuals across the system. And neither one of us represents our individual institutions when you see this presentation in its entirety, which we're making recommendations across the system for how the system should restart research and not really thinking just specifically about our own individual institutions. And as President Jarrell and also Dr. McCarthy and Dr. Locascio have mentioned, we are really grounded by CDC guidance, but we also want to be able to look at some advances in technology, mobile applications, and maybe have a higher protocol for a volunteer opportunity to evaluate lots of things while we're doing this restart of research. So the restart of research allows us to be exploratory in some areas, to look at operational strategies and evaluate some things as each of the institutions come online. So next chart, please. So the first thing we kind of sort of roughly talked about, what you heard from Dr. Locascio and Dr. McCarthy, was, you know, roughly we're thinking about this as a phase 0 to phase 1 strategy with roughly up to maybe 200 people, maybe a little bit more and a little bit less at each of the individual major research campuses across the USM. And so that's kind of our rough number. Don't take it too seriously. It's just roughly in that we thought that was a good number to restart research at each of the member campuses. In addition, as I said, above the normal CDC guidance of screening, monitoring, contact tracing, quarantine, isolation, we want this to possibly be an opportunity for those laboratories and their supervisors and personnel on a volunteer basis, if we can maybe take a higher level evaluation of testing at the various campuses. So essentially that a lab which gets approved could volunteer itself to be part of a higher level of screening, which is to do testing up front. It's an opportunity for us to understand how folks will be tested if we decided to do that going forward in a more deeper sense in the fall. So it's an opportunity for individuals to volunteer. It is not a requirement. It is simply a volunteer commitment by an individual lab at an individual institution. But it's an opportunity for us to, again, look at testing as a way to track symptoms and so forth and so on about each of the individuals in the lab. So, but generally screening is definitely required. So we'll be monitoring lab returnees for fever and COVID symptoms, as Dr. McCarthy mentioned. You have the REDCap web-based tool at UMB. There are other tools that other institutions are looking at as well. And really to educate our faculty and our researchers about the best social distancing practices and the best hygiene practices to prevent viral transmission. And then finally, the third part of what we at the system are recommending for each of the institutions to look at, examine the feasibility of mobile apps for health screening, wearable devices to assist with contact tracing, and of course, electronic temperature and symptoms device, wastewater detection of COVID-19, ultraviolet light systems possibly to learn about their feasibility and usefulness. Next chart, please. Phase 0, you heard from Dr. Locascio. I'm just sort of put it in a different context. The laboratory PI must file a research plan to be approved by the department or unit supervisor. Remember, this is broadly across the system. Specifically, you heard the details from UMB. Then, obviously, we want to know who's the name of the supervisor, the type of research that is going on in that particular laboratory, the number of personnel working in that laboratory, and the list of all individuals conducting research in that particular laboratory. We want to have a floor plan of the laboratory illustrating maximum occupancy that ensures social distancing measures are met, and we've targeted a consistent number with UMB, 200 square feet of separation inside the laboratory. Then research lab schedule for personnel to ensure social distancing across that 7 a.m. to 7 p.m. timeframe for, in this case, UMB, but broadly across the system as well. And then a circulation pattern. As we know, sometimes some laboratory environments are tight, some are more open, but we want to recommend a circulation pattern for movement inside of the laboratory or inside multiple adjacent laboratories that are part of the supervisor's authority. And you've heard discussions about the amount of appropriate PPE for that particular lab. We want to know what's the recommended PPE for that lab. And then, of course, there comes the logistics of purchasing and getting folks equipped with the right PPE. Location of hand sanitizer stations inside and possibly outside of the laboratory so that we are maintaining high level of hygiene within the space. A laboratory notebook to monitor daily lab activities and to record daily health screenings in a sort of a paper, a hard copy way, instead of just a digital way, just in case digital technology fails us, we could do this in the laboratory on a daily basis for all members of the lab. The use of remote temperature sensor to be determined, to be specified in the future, which is going to come from a partnership with Kinza that Dr. Kate Tracy has at UMB, who's part of our USM testing group. Proof that the laboratory has been cleaned to restart research activities. So somehow the PI or laboratory personnel may clean the lab, or others may come in and clean the lab from the housekeeping staff. We want to know that the lab has been cleaned. And then there's a daily approach to cleaning the lab at the end of the day so we can restart it for research for the next day. All personnel should be certified, either having seen a COVID-19 training video, as mentioned by Dr. McCarthy, or informed about hazards and best practices as it relates to COVID-19. So that's the phase 0 that the system is recommending for the restart of research. Next chart, please. Phase 1, essentially research laboratory preparedness and getting ready to start the daily logistics of doing laboratory screening, and in some cases, volunteer testing of different groups. So a daily sign-in of log of who's in the lab on a daily basis, the monitoring of, again, individual temperature at the beginning of the day and possibly at the end of the day using a health app to be determined, the monitoring of any symptoms and recording this information, again, using a health app and also using the laboratory notebook, social distancing within the laboratory environment, as you heard from Dr. Lacasio, cleaning again of the lab surfaces at the end of the day to prepare the lab for the next day, the use of now wearables possibly for possible contact tracing by all personnel, a vendor to be determined and recommended by this group, wearing of appropriate PPE for the specific research that goes on in that lab, and then a minimum must wear surgical mask inside of the lab. That's a minimum requirement for all persons working inside of a closed lab environment. Number 2, COVID PCR testing of lab personnel. Again, this is only for those entities or labs that want to volunteer to do this. We just think it's a great opportunity for us to evaluate the use of testing of a given lab and then be able to use that as the bench point at the initial condition and then track it going forward with screening and tracking of symptoms. Again, it's not required, just a volunteer opportunity. We will not require a negative COVID PCR test for those returning to the lab. We will make it available on a volunteer basis and on a first come, first served basis up to 200 COVID PCR tests for those returning. And then COVID PCR testing will be required if daily temperature or symptom screening are suggestive of COVID-like symptoms. And so that's when you obviously have been screening, and then it may be required that you have a COVID PCR test. Okay, next chart. So we also want to use this opportunity, as I mentioned at the beginning, to evaluate various technologies. Dr. Kate Tracy has been working with Kinza to essentially look at a temperature monitoring approach that also comes with a detailed health screening that goes with the temperature measurement. So that will probably be used at UMB, will probably be used at other institutions as well. That's one of the recommended manufacturers and partnerships that we have. We're also looking at a couple of wearable technologies for contact tracing. This may require personnel in the lab, if recommended, to essentially wear either a wristband or a around the neck pendant that essentially allows us to track your interactions with others in the lab. It would need to be a compliance of everyone in the lab for this to happen so that we can track everyone's movement in and out of the lab and make sure that they're maintaining social distancing recommendations. So that will be something that's under the works now and TBD, and hopefully be recommended in another week or so. Next chart, please. Other preventive measures to be evaluated. So there's a number of folks on our committee who are in a couple of different spaces. Some of them are civil and environmental engineers. And what has been uncovered in multiple research studies across the world is that if you track effluent that leaves buildings and goes into the wastewater, you have the ability to track COVID-19 in a particular building or obviously in the wastewater effluent that goes into the wastewater system. And it turns out it's a pretty good measurement to say that there's something going on in that building. We don't know specifically at what floor, but it will say that that building contains COVID-19. And it's sort of a preventive early warning indicator that something's going on, and that then it may trigger a test of all of the individuals in that specific building or at a specific floor of that building. So we think it's a good opportunity to look at that experimental technology. Obviously, the use of cameras to track folks going in and out of buildings that get a correct number count of we've got 10 people in the lab, but now we had 15 people showing up on the camera. So are we coming into contact with other individuals who are not connected to that research environment? And will they affect symptoms that we see during screening? And then number three, there's been a lot of discussions about ultraviolet light and the use of these systems for killing microorganisms in the air. There are even ultraviolet robots that you can deploy in the laboratory after hours that can actually go through the entire laboratory, and its role is strictly to kill the microorganisms in the air. There hasn't been a lot of studies on COVID-19, but it's an opportunity to study this as a way to obviously mitigate, again, the environment. So we may look at this technology, we may not look at this technology right now. It's an early look that we've been looking at a couple of these robots, but we just wanted to make you all aware of that going forward. And that concludes my presentation of what the system is thinking about, and I'm happy to answer any questions.
So one or two comments for the group listening. We've obviously spent a lot of time on this. This is still a work in progress, but part of what you're seeing here is that we're also trying to learn what better ways there are to monitor this. Now, having said that, I think both of us have a very big caveat sitting in the back of our heads, and that is there's this term called privacy, and this is not about a big brother operation. We need to figure out what's appropriate, what's safe, and what's within not only the law, but also the way we want to be treated as faculty, staff, or students. So there's a lot of those issues that we will have to address, which is why you're seeing this in a preliminary form. But the interesting thing is there's a lot of technology out there, and you're all hearing about that. We're hearing about it too. We know some of it works. We know some of it doesn't work. And so applying an engineering approach to this is a really important part of what we're trying to do here and learn. So with that, maybe I'll ask if anyone has questions relative to Dr. Pines or left over from UMB.
Well, we have a question from AI, which is I'm not sure who that is. Those are great initials for this discussion. Regarding the wearable, is that in the fully optional category? Because as you really are proposing that we need to have every single movement we make within the building GPS tracked. If it's a pilot within a few people who volunteer, fine, but tracking every single person in the building, he thinks that's unlikely. He or she, I should say, thinks that's unlikely to fly.
Yeah, I don't think we're saying track everyone in the building. We're saying that we would love for an individual research group to have everyone in that research group in compliance, since they come in contact with one another in a research group, in a research laboratory. So the idea that that group would say, yeah, we're interested in trying out that technology. By the way, that is probably the most private of any of the technology that we're recommending. That it's not connected to a mobile phone. It's simply, and I'll give you a little bit more background, it's just a radio frequency type of approach. That requires a base station where you know where the base station is. And now once you know where the base station is, you can know where everyone on that particular floor is within centimeters. And so it's actually a technology that's used by firefighters to find firefighters inside of a building. They set up a base station outside of the building, and then they deploy these wearables with the firefighters, and they're able to locate if someone gets lost in that building.
But I think we all share your concern about privacy and not
Absolutely.
flying. And so that's got to be a key component of how we look at these things. Alex?
Okay. Yes, we have Joe Staines. Joe, if you're with us, you want to make a comment?
Yeah, sure. I guess I'm confused and surprised by some of the requirements that are being put forth. This seems more restrictive than anything the state government has mandated. And I'm curious why. Like my wife's dog daycare business is operational. We go to the grocery store without this level of restriction. Is this just a liability issue, or is this really something we think has evidence behind it for preventing infection within our labs?
Are you talking about my presentation, or are you talking about Dr. McCarthy and Dr. LaCasu? Let me just speak for my presentation. My presentation follows exactly the same guidance that Dr. McCarthy and Dr. LaCasio gave you. The only thing I added, or the system has added, is essentially an opportunity to volunteer for testing. That is the only, and then a discussion about the use of technology. Again,
I apologize. I got on the call late because I had a conflicting Zoom call,
okay.
and so I'm just seeing this, and I'm sort of stunned by these all seem like great ideas. I just don't know that there's evidence to support their use, and how much we really think this will change the trajectory of what's happening.
So Joe, let me get at that for a minute. So if there's one fundamental thing that's taking place in our system committee, and I suspect this was true for Peg and Laurie's committee as well, as we absolutely relied on medical experts and epidemiologists in terms of figuring this out. And so is there evidence for social distancing protecting? There are data now coming out in support of that. Certainly PPE, the data for masks, I could agree with you, is confusing at times, but on the other hand, I think our infection control people would say that's a necessary point here. So I actually would not say that we're being more restrictive than the state, because the state actually still right now has masks in place and social distancing.
We're not contact tracing in the grocery store. We're not obligating PPE in the grocery store. We're not even keeping the space requirements that are being obligated for this lab. That's what's surprising to me. Like, we're getting that exposure in the community anyway. So why have more restrictive lab-based restrictions than we have in the community anyway? Like, if I can go out to Wegmans every weekend, I'm not sure why I should be more restrictive in the lab. My probability of infections occurring elsewhere is my main point.
Well, I don't know whether it's a value to get in a discussion of that detail on this particular town hall, but I think I would not agree with your proposition that we should be like the rest of the community. I think we need to be very careful in how we move forward in this. We are the stewards of a lot of young peoples, our students, et cetera. So I believe that this is a responsible way to behave, and that's how this has been designed. But again, I have to emphasize, this has been based upon what our experts in infection control and what our epidemiologists and what a lot of people who know a lot about these diseases, particularly this virus, have advised us. So that's our guiding light on this.
Can I also just add that unlike your wife's doggy daycare or your trips to Wegmans, those are very incidental, short-term exposures. The people in the laboratory are there for hours and hours, you know, and sometimes in close proximity to each other. So that's why these strict requirements are implemented, because it's well known the longer you're near somebody who is shedding virus, the greater your risk of contagion. And when you pass somebody in the grocery store, that's not the same as being in the same laboratory for them as them for 4, 6, maybe 8 hours.
Alex?
All right, if you have time for one more, we have Fadia Shaya. Fadia, are you there?
Yes, hi. Thank you very much for these presentations. I had a question about the third arm of research. So lab research, certainly clinical research, but a number of us also do database research. And I believe some guidance is needed there, although there's not the same urgency to return to the wet labs or to the clinical setting. But there are certain hurdles to continuing such research, say on medical data, drug data, social and behavioral data, because of system capacity and the different speed of computers, processors, etc. So that's an easy hurdle. However, is there a plan to address it? And I can follow up, Laurie, since now I'm newly on the task force on behalf of the Faculty Senate. We can follow up on that, but I would love to hear all of your thoughts on this.
Yeah, thank you. There was a discussion about that, about the use of resources on campus and the people who do databases and data and analytics, et cetera. And our recommendation is that if you're managing to do that successfully in place, at home, remotely, continue to do so. But if you require the use of particular resources on campus because it's detrimental to being able to do your research, to continue research, to process the data, you might need access to particular facilities on campus, then you would be treated as any other laboratory-based person. We would encourage you to come on campus, but and mark out your space and to use all of the appropriate precautions for safety, social distancing guidelines, et cetera, to do your research safely in that kind of domain. Peg might want to talk a little bit about single offices as well, because that was a discussion also.
Oh, yeah. Well, other than, again, if you can work at home, stay at home. But if you need to be in your office, then some people have asked the question, could there be transmission through the air ducts from one office to another? And that has been demonstrated that there is no risk there. So if you have a single office, you're fine.
Alex, we got any other burning questions?
Well, we have a lot of questions. I guess you wouldn't be surprised, but we do have a lot of questions. Amy Fulton is on the line, I think. Amy, do you want to ask one?
Yeah, am I unmuted?
No, you're unmuted. Go ahead. You're on.
Okay, yeah, so my question is, and thank you, first of all, for doing that. So I think it's a very conservative and realistic plan. It's going to increase confidence among people. My question is, does a building reopen only when every lab is in compliance in terms of training and cleaning and everything, or is it lab by lab?
Lab by lab.
Yeah, it's lab by lab.
Alex?
All right. Well, Scott Devine is asking about you have a space like HSF3, which is has very large open floor plans. There's a lot of shared space. He says, not sure how we'll keep 200 square feet per person. I mean, is there some idea how we might adjust how things are done there?
Well, Scott, I think, you have to go into the space, get in there, get your one person in there or you yourself and start to think about, it might be that you're going to have to say, move some equipment around. So if right now you've got your small centrifuge sitting right next to your gel electrophoresis or your PCR machine, and that would bring two people into close proximity, move them across the lab from each other, sort of thing. I don't think it's an issue particular to the large open labs. It's for all the labs. You have to start to think more cleverly about, envision what life was like pre-COVID, where were people clustering, where was the most common sort of, grouping, and then start to think about how you can break them apart so that you can achieve that distancing, because there's other areas in your lab that probably there's very little use. And maybe now you need to clean off that bench that's just been cluttered with old boxes of test tubes and stuff and move something over there and open it up for an investigator.
If our three panelists still have a few more minutes, maybe we'll take a couple more questions. If one of you has to sign off, please don't feel bad about that. But if there's a lot of questions, it'd be nice to get to a few more.
Sure.
Alex?
Okay, here's Iris Lindberg. Iris, are you there?
I am. Can you hear me?
Yes, go ahead.
So I was proactive in ordering PPE for the lab because I gave all of the material we had, including all our gloves, to the hospital. So I thought, well, we're going to need this. And I ordered it May 6th. It looked like it had a 2 to 3 day turnaround on BioResco. When I checked with Carol, she said it was going to come in late July. Are we going to do what Daryl is proposing here and ensure an adequate supply of PPE for people?
Hi, Iris. And I think what I would say is we've got a lot of work to do there, and we are focused on it. Obviously, you need the PPE to open, and we need to get it to you sooner rather than later. So it's a point of focus. It's the best assurance I can give you right this second.
Yeah, and I would also add, Iris, that a lot of labs donated the majority of their PPE to the hospital, but held a little bit back. in preparation. And so I think with, some reaching out to your colleagues and saying, hey, can you spare a box of medium latex gloves? You might be able to, get going for a while. And then just very, very judicious use of that PPE when you need it. Masks shouldn't be limiting. You're allowed to use your own masks. And, for a laboratory like yours, which I'm well familiar with, it's going to be the gloves will be the limiting factor.
All right, Mary McKenna has a question that is really, she's thinking ahead about testing systems beyond COVID-19. Mary, are you there? Go ahead, you can ask your question. Well, she muted herself. She says, I've read about concerns of the risk of Legionella in air handling systems that have been shut down or run at lower capacity, as many of ours have been for quite a while. Are they going to check the air handling systems at UMB prior to opening?
That's a great question. And in fact, it was in one of the magazines or newspapers a weekend or two ago about opening up the New York City high rises and the concern about Legionella. As soon as I saw that, I got that article to our facilities people to say, are you thinking about this? And they said, we've already thought of it. We're looking into it. We're going to make sure that doesn't occur. So I think what I want to do is give you an assurance that somebody's thinking about that, but thank you for bringing it up.
All right, Sarah Cotting has a question. Sarah, are you there? Well, I'm going to give you one more second, Sarah, because I came to you very quickly. If you're there, go ahead and ask your question. I'll ask it for her. She says, I'm excited to return to work. Thank you. The testing of new equipment to supply data to combat COVID while performing our own research is exciting too. Feeling safe with the implemented PPE requirements and testing too. Thank you for all your work and commitment to our health and safety and the time it took to get this up. It's nice to get some positive feedback.
Great way to end.
I think that's wonderful.
Yeah, sure. Go out a winner. That's right.
All right. Well, we should take her up on that then. And so I want to thank our three panelists very, very much. It was a most interesting and useful discussion. Thank you for all the work you've done and put into this to make it a living document. Unfortunately, your work isn't done. The revisions are coming back from the editors as we speak, I'm sure. But in any event, thank you again. And I look forward to getting these things up and running by the schedule you have proposed as quickly as possible. So with that, thank you all. And you'll be hearing from us on clinical research very shortly. So goodbye.
Bruce, appreciate it. Take care.